really recognizing the quote that's up above there: the human cost of continued widespread homelessness and the vast racial disparities among those most impacted are not acceptable. These challenges require us to unify and to build an aligned response system. As was talked about earlier today as well, we have our Home Together 2026 community plan. What I've highlighted there in the first objective is prevent homelessness to our residents, and primarily what's outlined in there is focusing resources for prevention efforts. Some of these items that we referenced earlier this morning as well, importantly on this slide, shows the table. Oh, it is hard to read from out here. Our Home Together progress update, what it shows is our investments in order to turn the curve. We'll need to continue these investments, not only the one time, but really building upon ongoing infrastructure and ongoing needs. Ongoing sustainability. And in order to do so, what the impact would be is that we'd be able to turn that curve, which is what we see there in the orange, if we're able to really invest in those opportunities. This was also showcased earlier this morning. What this really shows and where this is impactful is that we really need to reduce the inflow into our system, as well as enhancing and continuing the outflow. So what you see there in orange, again, is the number of individuals who gained, bless you, and were connected to housing. And then what you see there in blue is our new homelessness and returns to homelessness. And just in terms of context, what that shows is that there's over 4,000 people who became newly homeless in Alameda County in fiscal year 22-23. While an additional 449 became homeless again after having successfully been rehoused. And then just for context, that during that same time period, 4,263 people were rehoused. Yeah, which is huge kudos, yeah. And what we know in terms of outflow is that that's just the closest that the rehousing rate has gotten to meeting new homelessness, so meeting our inflow in the last 4 years. So that's significant efforts and significant impact. What we also see is that then there's new homelessness or returns to homelessness that are also presenting, and individuals who are coming into our system. And then the main takeaway is we really need to turn that curve. In order to do so, we need to reduce the inflow and reduce the inflow rate in the sense that we dip deeply below the outflow rate and consistently remain there. This was also referenced earlier this morning in the Home Together plan. What we know is that there's racial disparities in our new homelessness. The risk of homelessness is not evenly distributed across the population. The racial disparities reported in the Home Together plan are even more pronounced in rates of new homelessness and returns. And we saw this slide earlier today, as well as the table. Of those who entered the homelessness response system for the first time in fiscal year 2022, more than 50%, so 54% identified as Black African American, and that's 5 times the proportion of Black African Americans in the overall county population. A stark representation of the way that structural racism operates across historically Black communities throughout Alameda County. So the development of the homelessness prevention framework, preventing homelessness is goal number 1, as we saw earlier in the slide, in the Home Together 2026 community plan. It also outlines the critical objective to realize this goal. What came about then was the homelessness prevention framework was developed, and a lot of those in this room and virtually in this room were stakeholders as part of the, thank you. Thank you. Sure. Sorry, you all. No. Thank you.
Sorry, everyone. We're going to take a quick pause. Okay, we'll be right back, y'all. Be right back. Halfway.
Okay, yeah, thank you. Appreciate it. Thanks for your patience all. Okay, so the homelessness prevention framework, as was referenced previously, was developed using evidence from national research, key informant interviews, nonprofit leaders, as well as local government, and input from stakeholders with lived and professional expertise. A lot of you in this room took part in that. Thank you very much. Also a lot of individuals who are also on the virtual or in the Zoom room took part in this. The stakeholders met as the homelessness prevention strategy team. So we like acronyms, HPST. During their duration of 2023, they met a total of 8 times to draft the framework. And what we're going to share with you all is some objectives that have been developed from that framework, as well as talking about next steps and timelines. So I will transition it to Jonathan. Oh, it is still me.
Go, please.
It's still me. In terms of what we talked about in the homelessness prevention strategy framework team was we really talked about existing programs in our community that provide prevention work. So a lot of them are represented on that screen there. As well as each of those programs did presentations to the HPST team to help with providing some guidance in terms of development of that framework. And what we know too is that there are a variety of programs as well as those demonstrated on the screen. There's a variety of them that are embedded in our mainstream system of care. However, what we also know is that not all of these programs are targeted to those that are most at risk of housing loss, and none of these are currently scaled to meet the need. So what came from the prevention strategy team was development. Oh, no, you're fine. Yeah, no. You keep going. The components of a coordinated prevention response are outlined in the screen. It's hard to read there. We're happy to share the slides after. The primary pieces, oh, thank you. The primary pieces include targeted prevention programs. So what that means are well-designed homelessness prevention programs that offer a diverse array of services available in time to meet the urgency of each household housing crisis. So it's timely intervention and targeted intervention. as well as a homelessness prevention network. And what that means, our programs are offered through a facilitated network that has shared priorities. So really strategizing together and unifying together, targeted outreach, and approaches that also include information gathering and evaluation processes. The components also include integration with upstream systems. So really connecting individuals to mainstream systems that work with at-risk households, including healthcare, criminal, legal, employment, education, child welfare, aging and disability, and veteran services programs. Lastly, in this quadrant is a supportive policy environment. And what that means is that policies such as tenant protections, legal rights, and education for tenants, landlords, pay and workplace protections, public benefit levels, and expansion of affordable housing. So really emphasizing there a supportive network and a supportive policy environment. Ooh. Okay, now transitioning.
Thanks, Jeanette. As we've discussed a lot today, I think one of the things, and I want to share an anecdote to this effect in relation to where the intersections of race and prevention, I think, are deeply present. Obviously, inflow, as we talk about, is the place in which if we don't stem the tide on folks that are becoming homeless, then no matter of work, helping folks exit is enough. And it's interesting, I think, in our original plan, you can see number one on our plan talks about prevention, but because we didn't have any dollars, we didn't really budget for it. So it's important, I think, to lift up that this process is actually saying we need to add this focus in a financial way, in a targeted way to the plan. So this next year, I think, is really going to be working with this group and others to do more of an actual update and infusion of this approach. I got into this work, I was on the HPST as a provider, working for an agency that had developed and launched Keep Oakland Housed, one of the early prevention pilots in Oakland in 2018. And that program, I think, like many others, and I think that's a real shout out to this community in Alameda County, is a lot of the learnings, some of which have been scaled nationally and looked at nationally on prevention, targeted, equity-oriented prevention models were born in this county. So a lot of what we're talking about is taking those existing models and the learnings and saying we need to scale this to a county-wide approach. And so I share this statistic to sort of lift up the importance of the intersection of where I think prevention represents one of the closest intersections of the larger issues of racial injustice in housing. Housing injustice really is the center of the struggle in Oakland in many ways. As an operator of Keep Oakland Housed, this program, this is a complex statistic, but I'm going to go through it so folks can track with me. I think it's a very real representation. In the beginning of the pandemic, in the first 8 months of the pandemic, there were thousands of applicants from Oakland with the infusion of funds. Now, that program used a targeted model that had a screening, that had proxies using zip codes for racial equity to really make sure we were lifting up the Black and brown households most at risk and obviously vastly disproportionately represented in the inflow to homelessness. And we were able to zero in on actual individual neighborhoods in Oakland, Deep East Oakland, some of the targeted areas that we really wanted to make sure we got resources to. And in that time, of the extremely low incomes in one zip code in the Seminary area of East Oakland, 7 in 10 of the extremely low income Black applicants, this is hundreds of applicants in one neighborhood, 7 in 10 had previous experiences of homelessness and were right at the risk of experiencing homelessness again, right? So that homelessness prevention there is preventing 7 in 10 people had already experienced it at some point in their life. Through centralized models like this, we were able to compare, all things being equal, the same neighborhood, the same income levels. White households, less than 4 had those previous experiences of homelessness that were applying, right? So this vivid example, and not to get too into the weeds, but that sticks in my mind as an example where we can literally target that race in that category is the distinguishing mark, not income, not even neighborhood, but the racialized nature of the pressures that we see in Oakland as an example. So all that to say, I'm not going to read these paragraphs, but it is in the space of prevention that we see the most importance to do targeted equity-oriented approaches. And that is why we have 54% of those falling into our homelessness response system, is because all of those structural factors are pressing people out of their homes and onto their streets. And so we need a prevention model that centers equity across all of it. So all of these objectives, I probably spent all of my time just talking about that one thing, need to be bathed in a focus on a truly targeted approach with our resources. So as we discussed, I think addressing the racial disparities in mainstream upstream systems to prevent racially disproportionate inflow into homelessness, which is a fancy way of saying we've got to be working up the stream as we develop systems down the stream. This model is going to require us to have a very targeted front door, nimble response to folks that are most at risk. But if we develop another system that's isolated from the broader sense of networks and supports, then we're just going to create another complex little silo, right? So it has to be integrated with the larger system of care, and the word and the access to this and the resources need to be integrated with all the mainstreams, providers, social services, and others, to where we can have a coordinated environment. Focusing those on folks that are most likely to lose their homes. Again, we need evidence-based, equity-informed tools. A centralized system would allow us to have a tool that could really use the evidence-based markers like zip code proxies that I described to really make sure we're targeting these resources. We also need to really be able to do this rapidly, right? It needs to be low barrier. This needs to be everywhere and accessible. It can't be through 14 doors and 10 applications just to get your needs met. We need to be able to screen quickly and respond quickly. As I learned doing this work as a direct service provider, we know we're serving the right folks if it's really hard to get an ID or get a documentation of need, right? So we need to make sure those barriers are inverted and we reduce the barriers for those and prioritize folks that are in unleased situations, right? That might be on the couch. All of these things that traditionally have become, are missed, right? We have these gaps. We have legal protections up here, which are extremely important, but there's a lot of people that are past that mark, right? They're not in a situation where they're in that network. They're in a much more vague situation that's between that and before the homelessness response system. So we need something that can sit in there in between and work to support people quickly. And of course, as I already discussed, one of the core objectives through all of this needs to be to prevent the racially disproportionate returns to homelessness. We talked earlier about the original racial equity and system design report that was born out of the system modeling done in 2018, 2019, and 2020. And one of the primary areas we saw there was that in relation to, though we are housing people that enter the system in proportion, so we got positive exits in proportion to the people that are coming in based on race, we see disproportionate returns, particularly among Black and Indigenous households from programs like rapid rehousing, right? So when the short-term subsidy ends, all of those structural forces in society continue to exist and folks are falling back in. So we need to design our systems to be responsive to that. And right, prevention is where one of the ways we can do that. So
support systems just like supportive housing.
That's right.
But rapid housing does it. Portion of those who are in rapid housing are predominantly Black.
That's right.
So we need to, when you're talking about centering racial equity, we really need to consider these things that are baked into the system, which is exclusive in and of itself.
Absolutely.
Okay.
Say it again, Arlene. So just to recap what Arlene said, the ways in which the disproportionate access to some of the resources and supports we have, right? Like the way that the way that rapid rehousing is structured to lack some of those supportive services, right? Or those invariably end when subsidies end, do not account for these issues. And I think part of that is we need to, and not to go back to the Home Together plan, but we know that supportive housing is not the only intervention folks need in our community, right? And if we only build more supportive housing, then we're going to create a pipeline where folks just wait and languish in some cases until their needs get that complex, right? And so that's really why we're driving for more deeply affordable housing than others that support. Sometimes, it's wild that we have to say it, but homelessness sometimes is just an economic thing for folks, right? It's not always tied into all these other co-occurring issues that we unfortunately, the press sometimes focus too much on, right? Those are certainly there, but they're not all that's there. And okay, so lastly, we mentioned this, we want to create a policy environment. So again, tying homeless prevention into a larger strategy of tenant protections and organizing and really making sure that we are on the legal services front, on the tenant protections front, that is a deeply integrated part, networked into a larger focus on preventing folks being pushed out of their homes. Okay, so here's the really exciting part, because we've got all the money right in front of us. Just kidding. So we did also some study based on the data of what we have on what this would cost to build a system in this way. So to achieve these reductions in a targeted way, significant new investments are needed. Those investments, at a minimum, we estimated that $10 million would be needed just to reduce the annual returns to reduce from 16% our recidivism rate we talked about earlier to 9%. That's 500 or so households. Now, what this accounts for, not to get too into the weeds, is homelessness prevention work is hypothetical work, right? We are doing our targeting because we're trying to identify and support folks that would not, for that assistance, where would they be, right? Homeless. But we know invariably that means we're going to serve some folks that might, if the counterfactual situation came and they didn't receive assistance, they might not fall into homelessness, right? So it's accounting for that and assuming that only a percentage of the people we serve would actually have fallen and become homeless and show up in HMIS again if we didn't. So this number is assuming that we serve a larger proportion than just those that would fall in, but it assumes that at least those that are returning to our system, which I think last year was in the 400 and something returns to homelessness, would cost about this much to reduce it. Going more broadly, looking at the inflow, we estimate that $43 million a year would be needed to reduce the inflow system-wide by 1,070 people annually. So we would need a system of that size and scale with all the objectives we just described, annually operating to prevent that orange line we saw. Was it the blue line? The blue line that is going up in terms of inflow. We also talked a lot about the infrastructure. So how would we develop a countywide system? How would this work, right? We need to identify the agencies, the partners, a shared data system, right? The Homelessness Prevention and Housing Stability Committee, very excited that that now exists as a part of the COC, would be an integral partner to this, to really fund and develop the administrative capacity, right? To develop the provider network, all of these critical things to have a countywide system. So here's a quick mock-up of kind of the aggregate of all the great minds and ideas in that group coming together to talk about what this would need to look like. You see centrally, shout out to the COC committee, the committee, right, from a community perspective, speaking into this model, giving feedback, overseeing the work. The Housing Stability and Homelessness Prevention Committee would be one of the central partners. The integration with the county's broader mainstream systems, right? This can't be just like the little homeless services system over here. It has to be about all the systems that folks that are at a risk of housing, social services, and otherwise touch, right? How they have to be at the table. And then also we would need really a central homelessness prevention services network lead agency or partner. So some place, nonprofit or otherwise, that this central hub, the actual operations and services and network would live. And then what we call the Homelessness Prevention Response Administrative Hub. So again, some subset or office or part of the county or the government that would serve to facilitate all of these diverse parts of the system.
Can I ask you a
Please,
question?
please.
The hub, will that be oversight compliance of not only of the system for the CLC, but the providers?
Exactly,
And those who are doing that, like, who owns the city buildings, right?
exactly.
City buildings that's not being repaired and it's an ongoing thing, and we still use the same contract.
Yes.
And so how is that baked into this administrative hub?
Great point. Yeah, this would be, if I'm, summarizing correctly, this would be the entity that would sort of create and manage the data and outcomes and performance of the network of providers providing the service under the direction and guidance of the COC committees, partnering Alameda County agency offices and stuff. So the data system and the reporting, all the participating, all the community members supported, right? All that data and all that integration, all that contracting and compliance would be supported by the hub overall.
And this is associated vendors that also
Correct.
participate.
all participating.
not just those who are actually providers. of
Correct,
services.
correct.
Thank you.
Again, this is all kind of conceptual at this point too. Yeah. Oh, yeah. Yeah.
But I'm wondering, there's legal services, like, are we going to grab these other entities?
Yes.
Ourselves? Okay.
Legal services would kind of be in this, kind of covered in this internal mainstream systems convening, right? So where are the places, obviously, Alameda County CDA, right? Doing Alameda County Housing Secure, funding the eviction protections program, right? And the legal services providers there. Oakland Housing Secure program that is providing those, the legal tenant protections. Intimately involved as one of those stakeholders at the table providing support, right? But importantly, we need to make sure we don't just reduce homelessness prevention to the legal protections, right? It's more than that for many people. It's like, I need rent for the foregoing next 6 months, right? I need like connections, and it might be groceries for 6 months to stay at my aunt's house, right? Like that's not just covered by those costs, but it very often includes that. So it's integrated. Yeah, great question.
I guess I'm bringing up now just so we can capture it for the
Yeah.
record that there are several entities, of course, already doing some, but also
Yes.
in order for us to have action.
Yeah.
And I don't want to just measure, something, but I want us to actually do something. Close to that.
100.
Overlap in our committee is fantastic, that's keeping us fantastic, but it would really be, if you can be realistic about. That's it, that's deposit money request, but you just say
Yeah.
like 6 months.
Yeah.
Right?
And the vast majority of that 10 million and 43 million is the direct assistance, right? We know from these prevention models that we need to get dollars in people's hands when they need them, and they need to be able to use them flexibly. That's the heart of prevention, right? With the associated services that are needed. So that really is, the model that is shown to work on other communities. So we talked about, this is kind of another way of restating some of the framework. I know we're a little bit slow on time, so I'm gonna go past that. Where do we go from here? Well, we prevented this too. We kind of are getting feedback on the plan from the stakeholders now, aggregating that from the folks that participated in the year-long strategy team. The framework had been kind of drafted and put together with the supporting consultant, Focus Strategies, who has done a great job helping to facilitate that dynamic group of folks throughout 2023. We reviewed and brought that draft to the Housing Stability and Homelessness Prevention Committee for a brief presentation, briefer than this one, last month, and is coming back this month to those folks to actually take hopefully some formal action to say, yep, we like this in general, let's move it forward. Our recommendation, though we leave it in the hands of the COC committee, is that goes to the Racial Equity Committee to do a deep review of the framework as well, to give thoughts and feedback, and then hopefully move forward to where we can move forward with the blessing across the COC to say, yep, we want this framework, we want to go find the money, and then really work to implement and incorporate that into the Home Together plan at large. Thank you. Questions, comments for, what do we have, 30 seconds, Chris?
Your timing was so perfect because I wanted to share that. So they can't hear questions. So when you get a question, if you repeat the question back, it's appreciated. Yeah.
Question.
No,
I
have a comment.
Yeah.
I just want to give people some context. When the pandemic happened, there was emergency rental assistance. And across the Bay Area, we all agreed on the intake process and how to prioritize for at-risk of homelessness. And so we met with San Francisco and Santa Clara and San Mateo, and we all got together and we agreed on the same things. In Alameda County, we had $200 million that went out that covered approximately 15 to 18 months. That's how much rental assistance is needed to help keep people housed. So the dollars that Jonathan is talking about, that's like the emergency, like, let me just help you get through this month. What we need ongoing and regularly is a hell of a lot more than that.
And
Amen.
we need a funding stream.
And we need a funding stream for that, because we don't have one. That was a one-time funding source that came and went with COVID.
As a heads up to everyone, when you give your questions, we can hear you really well on the mic, but we're still having a few tech issues.
So we're gonna.
I'm gonna
have-
repeat the question.
So that way everybody on Zoom can hear your question.
James?
Okay, my question is a simple one. You talked about rental protections, true. Where does the county stand in terms of getting just cause protection?
James's very astute question is, we talked about rental protections and the importance therein and asked where the county stands on that. I cannot speak for the county in terms of the elected officials, though there has been a lot of dialogue that I know Michelle Surratt could speak to at the board level that I will defer to her on.
We had a 2-2 vote with Miley abstaining, and he was the deciding factor. So pressure Miley.
Thank you for that input.
Everybody hear that? Marching orders.
We have a question from the chat for you.
Okay, question from the chat.
Question for clarity. So the hub could be a county or city or nonprofit entity.
Great question. I think there's, I actually need to go back to the more detailed description of each different entity here. But the hub would be that administrative core that I think would be more aptly structured as essentially a funder / administrative oversight to be a governmental entity facilitating, contracting with the provider network, reporting to relevant COC committees for policy and guidance. So more naturally a government entity, but not, I don't know if it technically would be required to be so, just a little more complex to not be. Great question.
Hi. Thank you so
Hi.
much. Great to
Oh, hi.
I know I don't have to ask anyone in this room to care. I know everyone here cares. So this is not the framework that this question is coming from.
Sure.
I'm wondering, when we talk about the homelessness prevention services, lead agencies and partnerships.
Yeah.
What partnerships are we making with people who are currently unhoused to lead the call for their own services so that they are telling us what they need in real time and that they are directing those services, not simply recipients, but active partners?
That's a great question.
Yeah.
I mean, I think to the theme that we've talked about before, right? It's not about being at the table, it's about leading the discussion. In the context of homelessness prevention, right? Just to kind of put an even more specific point on what you're saying, that involves convening and getting the feedback from folks that are most at risk of falling into homelessness, many who might have experienced homelessness in the past, but what are the present needs of folks most at risk? I can speak for, as an operator of a Oakland-based program for many years that was philanthropically funded for most of its life, and most recently, the city have committed funds toward the homelessness prevention in the past year, which is great. I want to lift that up, and it's having great impact. That involves sort of continuous feedback on how does this need to be designed, what's a barrier, what are the actual needs, right? Not just what does HUD say the needs are, not just what we would assume the dollar should be eligible for, but really defining the outline. So I think that the COC would be the engine of having those conversations to be like, all right, the money is forthcoming. How do we need to design this thing? And then how do we need to monitor it in a way that sets folks with that experience at the very front of the process from beginning to end. So yeah. Others? Ray.
I wanted to ask, okay. Hi, everyone. My name is Ray. I wanted to ask, you said, all right, I quoted you a little bit, but you said we see folks falling back into homelessness by supportive housing. Oh, I'm sorry. The way rapid rehousing is structured does not account to issues in the Home Together plan. I just want to know if you have like a little more details.
Sure.
Of like how it would.
Great question. So for the folks online, Ray's great question was referring back to the discussion of rapid rehousing, and some of the supports around there are not structured maybe how they should be to meet those supports. That was, again, drawing on the data review and the research that was done with the original racial equity system modeling that identified that folks that are Black and Indigenous are falling back out of rapid rehousing at higher rates than folks that are white, right, in a pretty clear way. So they're disproportionately falling back. I think the insufficiency is not so much in rapid rehousing itself. It's that temporary support very often doesn't account for all the larger structural societal issues that the homelessness response system, by providing subsidies and supportive services on its own, doesn't address, right? So I do think we need to be clear-eyed around what the response system, homelessness itself, can fix. But we can, at the very least, account for the way we provide those services and have a more equitable way of thinking. How long does this assistance need to be, right? And what additional supports might need to be there to address structural factors? Right now, our models have been pretty flat, right? They don't account for different ways of supporting folks. So I think that was my thinking in mentioning that. We have time for one more, and who has? I'm sorry, I'm letting you all decide. Julianne.
Hi, yeah, Julian Lyserson. I was the chair of the Results-Based Accountability Committee back when. I want to say thank you all so much for doing the work on prevention. I like to say that instead of fixing problems, I like to build solutions, and I can't help but feel like the work on homeless prevention tends to act as though the extrinsic factors that lead people to lose their housing are going to continue, and all we can do is catch them. And so I'd really like to encourage you guys to think about trying to tackle those other extrinsic factors that cause homelessness, like the fact that Wall Street is one of the biggest landlords, like the fact that we have rents that can go up uncontrollably, and all these other sorts of things, like the fact that we could actually have every single unsheltered homeless person if we put them in the vacant units in our community. And so would love to know what we're doing to tackle those issues and make sure those become a part of the conversation as well.
So we're just about ready to solve those, especially the Wall Street part, as that is number one on my job description. I don't know about yours. I mean, Julianne, I think, yeah, for sure. And that's an advocacy, and that's organizing, and that's sort of political movement stuff that I definitely think, to your point, we sometimes as systems don't name that enough. And we need to be honest about what we can affect at the local level, right? And so it's both advocacy and leveraging the dollars we do have. So, but yeah, I mean, I won't say it out loud, but I'm for, changing our whole political economy to something better than late stage capitalism. I did just say it out loud, but yes, amen. Okay, I think we have to be done with that comment about political revolution. Just kidding. Next up.